Welcome to the first case of the liver pathology slide review series. I remember you that you can have access to the whole slide images on Croscope. You just have to register, it's free, and you send me your Croscope ID at this mail address. Case number 1, this is some liver nodules that were developed in a 60-year-old female patient who consulted for abdominal discomfort. You will have a slide of one of the nodules. So let's have a look at the slide. You have here the nodule and here the adjacent liver parenchyma. We'll first take a quick look at the adjacent liver parenchyma. Nothing really remarkable. Here, normal liver with maybe just steatosis and maybe some fibrous areas in portal tracts. And now we'll go back to the tumor. You can see that there are different areas. Some areas in the center seems fibrotic. We'll have a closer look in these areas. And you have this fibrosis, and you have all these cells, which are the neoplastic cells that are large and have eosinophilic cytoplasm here. You have even these kind of cells with an intracytoplasmic vacuole that contains a red blood cells. You have the same picture here. There are some cells that look like spindle cells also. Again here, vacuole with a red blood cell. So this is the center of the lesion, and now we'll go take a look at the border, and you can see that within the lumen of the sinusoids you have these cells, also these neoplastic cells. They seem to infiltrate the adjacent parenchyma through the lumen of the sinusoids. You have here some cells here, probably this is a neoplastic cell also. Here again, you can see there's quite a lot of neoplastic cells in the lumen of the sinusoids at the border of the lesion. So we have a lesion with some fibrosis at the center, some cells that have epithelioid appearance, some cells with an intracytoplasmic vacuole and a red blood cell, so some signs of vascular differentiation. And we have an infiltrative particular pattern at the border with neoplastic cells in the lumen of sinusoids. So the first diagnosis to consider in this case is epithelioid hemangioendothelioma because of the fibrosis, because of the epithelioid appearance of the cells, because of the vascular differentiation with these intracytoplasmic vacuoles and red blood cells. You may also want to rule out the metastasis of a carcinoma by doing some immunohistochemistry, rule out other neoplasm, metastasis of another carcinoma from another organ. Another important differential diagnosis is angiosarcoma, so it may be challenging to differentiate epithelioid hemangioendothelioma from angiosarcoma. Usually for angiosarcoma you have more atypia. The clinical presentation also is very different with really adverse clinical outcome. There is no staining that truly allow to differentiate angiosarcoma from epithelioid hemangioendothelioma, even if the CAMT-1 staining needs to be evaluated, because you know that in epithelioid hemangioendothelioma there is a particular fusion that involves CAMTA1 gene and another partner, and there have been some reports of immunohistochemistry for nuclear detection of CAMTA1, for the diagnosis of epithelioid hemangioendothelioma. So in the most recent publication, it was very rare in angiosarcoma, so it has to be validated, but it's an interesting immunohistochemical marker. So in this case, you want to order other marker to confirm your diagnosis, and we'll have a look at them. So this is the CD34 staining to confirm the vascular origin of the lesion. You can see that staining is heterogeneous, but there are definitely some neoplastic cells that stain positives, lots of vessels here. Also here, some neoplastic cells that stain positive for CD34, and another vascular staining that is really useful and really easy to assess is ERG, and we'll take a look at the ERG immunostaining. So this is the ERG immunostaining. Even at low magnification, you can see that clearly nearly all neoplastic cells stain positive with this really strong nuclear staining for ERG. So if you have your confirmation that this tumor is of vascular origin, and you have your diagnosis of epithelioid hemangioendothelioma. And we'll jump now to the conclusion. So this case was an epithelioid hemangioendothelioma. Some learning points: you have these tumors that may be multiple. You have this fibrosis at the center. It's not always there, but it's a good clue for the diagnosis. You have these cells, these large neoplastic cells that look like epithelial cells, and it's important to search for this intracellular vascular differentiation with these vacuoles and the red blood cells. Of course, the vascular markers are really helpful, and also CAMTA1 immunohistochemistry needs to be further investigated for the diagnosis, in particular for the differential diagnosis with angiosarcoma, which is much more aggressive. So epithelioid hemangioendothelioma is not really a benign tumor because it can grow really quickly. It can be hard to remove. You may need to perform a liver transplantation, and you may have also distant metastasis. And it's really difficult to predict the clinical outcome. So I'm done with this case. I hope you enjoyed it, and stay tuned for more cases to come.